Everybody has worry and everybody has stress. So how do we know when our worry may actually be a warning sign of a more significant disorder? We're going to talk about that. So let's talk about anxiety. Anxiety is a big word that means a variety of things. For some people, they use the word anxiety or feeling anxious to mean that they're worrying and they're dwelling and they can't get their thoughts to stop. For other people, they mean physiological reaction that's more in the gut. Knotted stomach, heart racing, that foreboding, uneasy feeling. It can be everything from an uncomfortable annoyance to a dreaded, painful condition that interferes with your ability to function normally in your life. So if you are watching this and you're experiencing anxiety in any form, mild symptoms to a significant disorder, you're not alone. Over 40 million people are struggling with anxiety, which is twice as many people who suffer from depression. But the good news is most forms of anxiety can be treated. We need to be able to identify it and then utilize the appropriate strategies. So let's get started. Anxiety as a symptom or a reaction is not really a problem in and of itself. It becomes a problem or a disorder when a couple of things happen. When the anxiety symptoms are persistent, every day, all day long, and beginning to interfere with how you run your life, your relationships, your job, your health begins to suffer. Anxiety symptoms become a disorder when the reaction is disproportionate. So the things that you might be worrying about that require a small reaction, but disproportionately for people who have anxiety disorders, everything is a catastrophe. Everything is a problem. Everything is magnified. So when you start to look at your anxiety symptoms, paying attention to the proportion of your reaction to each of the stressful situations in your life to help you identify if this has become a problem. The other thing is taking a close look at how are you managing your anxiety. Do you find yourself leaning towards having an extra glass of wine to relax and decompress and get rid of the symptoms? Are you using other substances to help you relax and stabilize your mood? Or perhaps relying on food or unhealthy behaviors to simply distract yourself or move away from the distress that's caused by the anxiety symptoms? If these things are beginning to happen for you, it's a trigger, it's a reminder, it's a warning flag that you may have an anxiety disorder. So what causes anxiety or anxiety disorders? Well, there appears to be a number of different causes. First, we know that our biology plays a role. Our genes, how our brain processes neurotransmitters, which is the chemicals that regulate our mood. We know that anxiety and anxiety disorders tend to run in families. So we believe that there is a genetic underpinning to that. But we also have to take a close look at our environment. From the time we're little through our adulthood, we're exposed to a variety of things. Some traumatic situations, some stressful situations, how we cope, what messages we've received, where our self-confidence is, what we believe about ourselves, all can trigger off the anxiety response that leads us to experiencing sometimes anxiety disorders. We also know that women are twice as likely to develop anxiety disorders. In part, we believe this is related to the chemistry of the brain and hormones. But the good news is we can alter our risk factors by building a strong and resilient brain. How do we do that? I'm going to talk about that in a minute. But first, let's look at how do we actually diagnose anxiety disorders. As a health psychologist, I absolutely know that the mind and the body are connected. You can't have something happening to one without it affecting the other and vice versa. So the very first thing that we have to do when we diagnose an anxiety disorder is to begin with a thorough medical evaluation, including blood work. Why? Because sometimes anxiety is the first symptom or warning sign for an underlying medical condition, and it can often get misdiagnosed as an anxiety disorder. So for example, having your thyroid checked, because thyroid functioning of thyroid levels that are too high or too low can present with anxiety symptoms. Checking blood sugar levels, hypoglycemia, too low blood sugar, or hyperglycemia, too high of a blood sugar, can also give you the symptoms of an anxiety disorder. Checking for cardiovascular diseases. Certainly we know that when people have a panic attack, they experience cardiac symptoms, shortness of breath, tightness in their chest, heart racing, sweating, sometimes pain in their neck, all of which can mirror or mimic cardiovascular diseases and a heart attack. So it's important to get a good thorough workup if you're experiencing any of those symptoms. Vitamin deficiencies. If you're eating a good solid diet and getting good, maybe even taking a vitamin supplement, you should be fine. But it's important to have your vitamin levels checked periodically, particularly the B vitamins and particularly B12, because we know that when B12 is deficient, people tend to feel restless and irritable and anxious, much like they have an anxiety disorder. From a neurological perspective, we know that seizure disorders and head trauma can also mirror anxiety symptoms with a restless, anxious feeling. Then there's our medications. Some medications have a side effect of anxiety. So looking at birth control pills, medications for blood pressure, asthma medications, and even over-the-counter decongestants can have a side effect of anxiety. And after a thorough medical evaluation comes a psychological assessment to be able to identify the types of symptoms, the duration of the symptoms, and how the symptoms are beginning to interfere with your life. All of those things go together to begin to delineate what kind of anxiety condition you may or may not have and what specific disorder. Let's talk a little bit about those disorders. Two of the most prevalent anxiety disorders are phobic disorders and social anxiety. So a phobic disorder is an extreme reaction, a fearful response to a specific object or situation. So for example, fear of flying. Not just I feel a little restless or I'm uncomfortable getting on a plane, but absolute terror, panic symptoms, cardiovascular, heart racing, blood pressure up, sweating, intrusive thoughts running through your brain, fearful worry that becomes so disproportionate to the experience of flying. And sometimes then leading to avoiding flying. It can also be getting in an elevator or fear of spiders that again pose no specific threat, but your reaction is exaggerated and disproportionate. The second most prevalent type of anxiety disorder is social anxiety. This is a condition where you can begin to experience extreme anxiety just even thinking about going into an unknown or unfamiliar social experience. Thoughts begin to run through your mind of, what if I make a fool of myself? What if I embarrass myself? What if I don't know where to go? What if I start having anxiety and panic and then everybody sees me and I make a fool of myself? All of those symptoms, all of those thoughts can keep running through your brain. With social anxiety, there also becomes this avoidance, like I don't know what that place is like, it's a place I've never been, so it's better that I just don't go. Or fearful of something unknown, meeting different people, being in a crowd, so therefore you avoid. The real danger around social anxiety is not only physically what it does to the body, to have that chronic level of anxiety and worry and hypervigilance of your environment, always checking out where you're going and second guessing where you should go. But the other danger in that is by avoiding unfamiliar circumstances or unfamiliar social engagements, your world starts to shrink. And most people who struggle with the social anxiety will say that they tend to be pretty isolated and pretty lonely because of this avoidant behavior. Another anxiety disorder is post-traumatic stress disorder. And just like the name sounds, the symptoms of anxiety and the fearful reaction comes post-trauma. So people who've been exposed to traumatic events, either in their childhood, certainly our military, anything that's going to create this traumatic experience can lead to symptoms of having intrusive thoughts, visual images, flashbacks, difficulty sleeping, irritability, anger, depression, anxiety, panic. All of those symptoms are related to post-traumatic stress disorder. Another anxiety disorder is generalized anxiety. And just like the name sounds, most of the anxiety symptoms are generalized across the body and across the mind. So experiencing upset stomach, gastrointestinal difficulties, cardiac symptoms, tightness in your chest, heart racing, blood pressure can go up, difficulty with sleep, chronic worry, obsessive thoughts, all can be part of a generalized anxiety that really just stays at a low level. There may not be acute panic, but the generalized anxiety response is always operating. So the person is constantly experiencing a low level of anxiety in all situations. Another anxiety disorder is panic attacks. Now, most people will say once they've had one panic attack, the chronic fear and vigilance and worry about having a second is what creates more anxiety. Symptoms of a panic attack is this sudden, intense, extreme feeling of anxiety, heart racing, blood pressure up, skin begins to feel tingly, you can feel nauseated, lightheaded, dizzy. Again, all symptoms that mirror or mimic a heart attack. So sometimes for the first panic attack, people will say, I think I'm having a heart attack, and they'll take themselves to the hospital. Making sure that you do get a good cardiovascular workup to make sure that these symptoms are not cardiac in nature. Then there's obsessive-compulsive disorder, which is an extreme case of anxiety with obsessive worry. Now, all anxiety disorders can have worry as a component and obsessive thoughts that you worry about certain things and you play it over and over in your mind. But true obsessive-compulsive disorders is where these intrusive obsessive thoughts create so much anxiety and fear and distress that it's followed by a compulsive act to manage or bind up that anxiety. So things like chronic hand washing, making sure that you're washing repetitively to get rid of the anxiety and the fear of germs. Or people who will go several times through an intersection and then go back to the intersection and loop back several times for fear that their obsessive thoughts and worry is that they may have hit somebody in the intersection. And by engaging in that act of going back through the intersection several times, it will reduce their anxiety, reassure them. So with true obsessive-compulsive disorders, the compulsive act, well, it acts as a band-aid to manage some of the anxiety. Actually, in the end, it's like dumping gasoline on a fire, and it keeps the obsessive worry going, and it becomes a vicious loop. Okay, so what is the holistic treatment if you actually do have an anxiety disorder? The first thing is what I mentioned earlier, is to build a resilient brain. Whether or not you have a family history of anxiety, whether you've been through some traumatic experiences in your life, stressors that are still happening to you in your environment, you can still manage anxiety and get rid of your anxiety disorder by building a resilient brain that can fight against the anxiety. Research is very clear that something called neuroplasticity is the brain's ability to rebuild itself, for healthier cells to be regenerated, and for new connections to occur in the brain, to build a strong network or fiber that acts as a protective blanket against other diseases or conditions. So how do we do that? Well, the first and most important thing is that we pay close attention to our nutrition. We know that science is very, very clear about certain brain-boosting ingredients found in our diet that actually has anti-inflammatory properties and allows the neurons to thrive in the brain. So things like blueberries, turmeric, fatty fishes, kale, spinach, green leafy vegetables, we know has strong anti-inflammatory properties to build a strong and resilient brain to help us cope and manage conditions as they come. The other part of a healthy diet is to make sure that we are adding probiotics. There's been a lot of research that talks about the gut health being very important for brain health, and that the two communicate very directly with one another. So making sure that you have good bacteria in the gut through the incorporation of adding probiotics to your diet can also help build that very strong, resilient brain. So those are the things that you should be adding to your diet. The things that you should be making sure that you're limiting or removing from your diet are things like caffeine. Too much caffeine can automatically trigger that anxiety panic response. Making sure that you're moderately drinking alcohol. While alcohol might take the edge off and make you feel relaxed, alcohol has the ability to interrupt sleep, keeping us at a light level of sleep, not allowing us to go through the full 4 stages of the sleep cycle, which is where the brain rejuvenates itself. So making sure that you are drinking in moderation. The other thing that you can do from a holistic treatment standpoint is to engage in regular, consistent exercise. We need to be able to burn off the stress hormones once they've been triggered. And certainly with anxiety disorders, they're chronically being released throughout the body. We need to find a way to turn off the amygdala, which is the switchboard operator in the brain that sends a signal to release all of the stress hormones like cortisol and adrenaline. So exercise can help us tame that amygdala and quiet down the signals, and then eventually shut off the stress hormones. So the first thing when it comes to exercise that we need to pay close attention to is our breathing. Diaphragmatic breathing, or breathing from the diaphragm, taking deep, slow, cleansing breaths, actually stimulates the parasympathetic nervous system, which does in fact set off a chain of reactions that shuts off the signal to the amygdala. And we know that regular exercise that increases the heart rate and gets the cardiovascular system pumping increases oxygen and reduces anxiety. Practicing mindfulness techniques. Now that's a word that we use quite often, but what it really means in its simplest form is to stay present, focused. Anxiety lives in our future. It's the what ifs and the oh my gods. But in the present, through mindful techniques, we're able to mitigate that reaction, staying focused, not allowing ourselves to begin to worry about things and anticipate things that we can't control. So practicing good mindful techniques, again, begins with starting with appropriate breathing through the diaphragm, paying attention to our current circumstances, your thoughts as you are remaining relaxed and still, paying attention to your breathing, paying attention to your body, paying attention to your thoughts. Now I know that for many people they'll say, oh my gosh, I can sit quietly for a few minutes and then the thoughts start coming in. All of my worry thoughts, the things that I'm focusing on, the things that I'm afraid of, the things I'm dwelling on. When you're practicing good mindful techniques, paying attention to your breathing, staying present focused, allowing those thoughts to come in, acknowledge that they're there, and then allowing them to exit, because you're not acting on anything that is not happening to you in the present, avoiding the future worries of the what ifs. Another component to holistic treatment is cognitive behavioral strategies. What that translates into is looking at our cognition, our thoughts. What are we saying to ourselves? Examining those closely and then applying a corrective message. Are they realistic thoughts? Are they disproportionate thoughts? Where do those thoughts come from? How can we take power over those thoughts in our current state? And then managing our behavioral reaction to those thoughts. Oftentimes when we have an anxiety-ridden thought, our behavior follows. So changing the behavioral response to those thoughts is part of a cognitive behavioral treatment plan. And of course, in a true holistic approach, medications can be a valuable component to treating an anxiety disorder by altering the chemistry of the neurotransmitters in the brain, particularly serotonin. Remember, anxiety symptoms can be a warning for an underlying medical condition. Make sure you get a good medical workup, a good psychological evaluation to evaluate whether these are anxiety symptoms or actually have reached the level of an anxiety disorder. And then make sure that you are approaching your treatment from a holistic standpoint, taking good care of your nutrition, your exercise, your relationships, so that you have good, strong social support and engagement. And remember that anxiety lives in the future. When we anticipate and we worry about what's coming, we rob ourselves of our coping strategies here in the present state. If you want some more help or support in dealing with anticipatory anxiety, you can find that information here in one of the other videos that I've created for you around anxiety management. If you found this video helpful, please consider sharing it with somebody who could benefit. Give it a thumbs up and a like. And remember to hit the subscribe button and the bell to be notified every time we post another video here on this channel.